The art of using the tools is in the patient not having any idea that you're using tools on them until you tell them. Okay, so you can work through there. Then you can take the little tool and work right in between the spinous processes. There's little muscles, there's little ligaments, little tendons, and you see I can go right in between the vertebrae. You want to work through, on some people, each and every one of these little areas and work them through. I could go up one, and I can feel right through the tool. There's the area right there. Now the really nice thing about this tool, one of the nice things is if you come across a muscle, because of the shape of the tool, it will just lift up and over and not catch on that tight muscle. I could use the rounded tip on the precious tool. That one is really becoming one of my favorite tools. I can do this whole lamina groove really precise. Right there I feel a little speed bump. And I can hear a little vocalization from my patient as well. So I'm using the T-bar tool, and I'm using this flat edge and going along right along that root of the scapula. Now this part of this pointed area on the tool, I can slip right up hard against her root of the scapula. There's a little area deep underneath there where trigger points will hide and constantly reactivate. Will fit right in between the ribs beautifully. So you can palpate which direction they go, and there you can see I'm right in there, but I will of course have both of my hands on her body so I have complete control of where that tip goes. You can use this on the side of the foot as well. You can use this all over this calcaneus. When we go over here along this side, there's a muscle that runs right along there. She's very tender right in that spot. So in an actual therapeutic setting, I would press. Okay, the nice thing about the isolator tool is that it can isolate one head of the gastrocs. Now we can feel right through the tool. There's something that's probably a little bit tender there. Is that tender?
Yeah.
Yeah. And sometimes these two heads will actually get stuck to each other. And of course, this is great because you can actually bring that little prong in between them and get right down in there. Obviously, it would take... Okay, here in the piriformis, I could use this head of the femur. You know, as you know, there are ligaments that come down from the sacrum through this area, and some of them run down the shaft of the bone of the femur, the leg bone, and this tool fits right onto that. It cradles that bone really nicely. Can you feel that in there?
Yes.
Yeah. And now if I set this part of the tool right down on her back of her shoulder, just like that, that allows this part to penetrate up into that muscle. And if I take my fingers underneath here on this part of the tool, so I'm kind of cupping like this. For the sake of this video, I'm going to have to try to keep my hand away. Now, if I gather all of the trap away like this, and grab it here, I can now work that area. Can you feel that?
Mm-hmm.
Yeah, that's really effective. Now I'm pushing my fingers into this tool, into this edge, and also into this part here. As you probably know, the trap is kind of pup tent shaped. In other words, there's a part coming this way, part coming this way. And those two areas will sometimes grow together. They'll actually stick together. And one of the ways to treat that is to use your thumb and your fingers and to do this sort of a motion. But again, it's really hard on the thumb. You now have something that's stabilizing that trap, so it can't get away, can't squirt away. I'm not sure that it isn't even a little bit of the levator, a lot more effective than someone just working with their thumbs and fingers, perhaps.
Yes.
Yeah.
Much more specific.
Part of the tool on the deltoid, up through here as well, and of course the biceps. Okay, and we can do these muscles in the arm rhomboids. I can work through that whole area. Now, the difference between your patient getting better and just getting relief is usually how precise and how thorough you are. You can get tremendous results.
You're right on that one.